Welcome, everyone. We are glad that you could join us today for the next webinar in our Network Commons series, Self-Determination and Community Investment, How Native Leaders and Multi-Sector Partners are Investing in Health while Strengthening Self-Determination. So we are so thankful for the opportunity to have this conversation during Native American Heritage Month and learn directly from Native leaders and their partners who are leveraging multi-sector approaches to create healthier and thriving communities. My name is Ashley Hernandez, and I'm the Research and Product Manager of Build Healthy Places Network. And before we dive into the webinar, I want to acknowledge that I'm here speaking to you from San Francisco, the unceded territory of the Ramaytush Ohlone people, the original people of the San Francisco Peninsula, who have been custodians of this land for generations. And as I continue with this introduction to our work, please feel free to type in your name, your institutional affiliation, and if applicable, your tribal affiliation into the chat. So some quick housekeeping. Most of y'all are probably very familiar with Zoom by now, but just a quick reminder, use the Q&A function to suggest questions for our speakers and panelists, which we will get to towards the end of the webinar, and use the chat function for any technical difficulties that we can help you troubleshoot. We will also provide resources in the chat box as well. So quick reminder, Q&A for questions, chat box for technical issues and resources. So again, we are so excited to welcome you back to our Network Commons series. For those of you who are joining us for the first time, welcome to this space where we explore topics relevant to multi-sector approaches to improve health equity through facilitated conversations from experts, practitioners, and advocates from across the country. Build Healthy Places Network is part of the Public Health Institute, and we are a national center with the mission to foster multi-sector collaboration across healthcare, public health, and community development to help accelerate community-centered investments in health and racial equity. I also want to acknowledge Lynell Smith. She is the owner of Black Sheep Insight Consulting and Coaching, and she is also a member of Build Healthy Places Network's National Advisory Committee. She worked with us to design this webinar, and she will also be moderating the Q&A section at the end. So thank you so much to Lynell. So with that, we're going to begin today's programming by grounding ourselves through the power of storytelling. And I'm so excited to introduce Lori Tapanozo, a citizen of the Navajo Nation. She was also raised at the Ocomo Pueblo from New Mexico. And Lori is a public relations specialist. She's a teacher, she's a consultant, and a jeweler, and an actor, and a professional storyteller. So thank you so much, Lori, for joining us. If you'd like to join us on camera and audio, I will go ahead and pass it on to you to share your story with us this morning.
Sure, yat she Lori Tapahanso Yenish yat Toruk Ojanishle, a Shihi Beshichen Torich Ini Deshichena Kadeta and Dashanale Natanines Denasha. I'm also blessed and honored to be raised by the Acoma Pueblo here in New Mexico, where I am coming to you live from. That is how I'm known as a Navajo and Acoma woman with my clan support system around me. So thank you for the invitation to speak today. Right now, I'd like to invite you to just settle into your bodies and set some intention for the next hour. I invite you to engage in a superlative suspension of disbelief. So dream with me, imagine with me the possibilities of a future rooted in ancestral wisdom. So with that, let's imagine. There's a revered medicine man that many people speak about. People travel from all over the region to consult with him, to heal with him, and to fortify themselves with his gifts. He's in his mid-40s, so a young healer by traditional standards. Through his ceremonies, he teaches and guides his patients, his visitors, bridging the gap between his ancestral knowledge and the heritage lost in many of his patients through colonization. He invites them into the strangely familiar rhythm of wisdom, song, prayer, and healing. Having transitioned from a corporate world himself, this medicine man understands all too well the world his patients seek to heal from. He prays before each visit with ancestors that they will provide the means and reveal the remedy needed for healing. It's not unusual for him to share his gifts with institutions and businesses, often performing private ceremonies in public spaces to just restore harmony. Just imagine. Imagine a young Indigenous woman, intelligence wrapped in a witty personality and an infectious giggle. The tech world that she is drawn to navigate doesn't take her seriously, but she's undeterred in maneuvering in and around her destined profession to find the tiniest of openings in order to begin paving the pathway for equally brilliant Indigenous minds to follow in the future. She dabbles in AI, becoming a seed for the voice of an AI UN ambassador. She builds websites within minutes for fun, challenging herself to script new codes that automate things in simplistic ways so that elders and Indigenous leaders she offers her skills to can manage their own websites and technology without fear. Eventually, this young woman forges a path for herself to an educational institution where her research stretches the traditional boundaries of academia, yet she perseveres. She builds a comparative simulation tool that will demonstrate the impact of engineered biases on Indigenous community. Her innovative process would include youth and elder input, ensuring collective voices and stories. In this way, her project would serve as an educational resource and also facilitate discussion around how AI impacts our cultural realities and well-being. Just imagine. Imagine an emergent space at a local community college in the middle of a bustling city. The space is designed by Indigenous architects, the ground blessed by elders, the construction is fortified by food, laughter, and dreams. The timber sacrificed from ancestral lands is hand-carved by community members. The building prayed into existence, sung into reality, and alive because of a reverence to cultural norms, protocols, and standards. A space where visitors enter this living place. They are in awe of the beautiful energy that's maintained and informed by a community of elders, youth, and community members, often mimicking the home places that the young Indigenous students attend college come from. This holistic approach has the potential to support not only the academic success of the students, but also the overall well-being of the multi-generational community that envelops it and builds it. Just imagine. Our futures are unscripted, a blank page eager for stories. Just like stories of the past, they'll provide a blueprint, a pathway, a roadmap for future generations. And just like stories of the past, we must share what we know in order to ignite the fire of possibility in others. I hope you've been inspired by the stories about Lorenzo, Jim, Chamisa, Edmo, and the Lane Community College Longhouse as much as I have in my own life. Ahehe, and have a great seminar.
Thank you so much, Lori, for your wisdom and inspiration. And now I'm going to go ahead and move on in the Network Commons. And this time around, we're going to do something a little bit different. So rather than I, the moderator, introducing the speakers, I actually want to invite the speakers to give their own introductions by telling us their name, their organization, the role, and if applicable, their tribal affiliation. And just as importantly, I want them to answer one of these two questions. One, what inspires or motivates you to do this work personally? Two, what is one key takeaway you want our audience to leave with today? And with that, I'd like to invite the speakers on camera and on audio. Thank you. And let's go ahead and get started with Christine.
Hey, good morning or afternoon, depending on where you are. I'm Christine McPherson. My given name in English and Waysay Gishigokwe is my traditional name, Shiny Day Woman. I am from Sault Ste. Marie, Tribe of Chippewa Indians. I am both Odawa and Ojibwe and come from a very strong Native family. I have 10 brothers and sisters that I was born into that provided me with much support. I'm currently the executive director of the Sault Ste. Marie Tribe of Chippewa Indians, which is one of the largest tribes east of the Mississippi. We have over 50,000 members. Our service area covers the 7 counties of the Upper Peninsula, and we have numerous health centers, tribal offices to provide services to all of our members. I have been in this position for 10 years now, but had lots of experience working for my tribe for 40 years. So what's inspired me to do this, my family has always lived in a community that Indians were not always accepted, and I always wanted things to be better. We believe in the 7 generations, and we feel that all the work that we each do individually contributes to making things better, and that's what I strive to do. What I want people to get out of this webinar is really the strength of building community based partnerships and how that helps us all in our community. Because in Native culture, we do not just think about ourselves as a tribe. We think about everyone that lives within our service area, and everyone has a part and role within making things better for all communities. Thank you.
Thank you, Christine. Let's go to Karen next.
Thanks, Ashley, and good afternoon, everyone. My name is Karen Cheeseman. I'm the president and CEO here at the Mackinac Straits Health System. I joined the organization in 2000 and have really had the privilege of working alongside Christine and many others in this unique partnership. You know, similar to Christine, I think we share a lot of the same values and the same passion for rural healthcare. We care for our friends, neighbors, our family, and we get to do this very rewarding but challenging work each day to provide care for the community and really work very hard and collaboratively to meet some of the challenges that are unique to our geography in the Upper Peninsula here in Michigan. What I would like folks to take away from this webinar, this session today is really, as Christine touched on, the power of collaboration, all the things we do to come together and care for the community. I think it can be very daunting as you look at how you develop a relationship like this. It's really hard work, but really hope that with the information that we share this afternoon, for those that are considering this and maybe are new in exploring the relationships, just to really not underestimate the power of what can be done when you work together and you have great people supporting the work behind you. Thank you.
Yeah, thank you, Karen. Let's go ahead and move on to Dr. Andrea Garcia.
Hi, good morning. My name is Andrea Garcia. I'm a citizen of the 3 affiliated tribes, also known as Mandan, Hidatsa, and Arikara from the Fort Berthold Reservation in North Dakota. I myself am coming from and was born and raised in Los Angeles, California. I am a physician specialist with the Los Angeles County Department of Mental Health. However, today I'm wearing the hat of a collaborative member for the American Indian and Alaska Native Housing Collaborative, which you'll learn about later. One thing that I hope folks take away today, I see a lot of county health department representation and beyond that. So I would encourage or hope that folks take away the ability to trust Native organizations and Native tribes to be able to do the work that they know inherently to do to provide for their relatives. Yeah, I'll leave it at that. Just trust us. We're good partners. We come with good intentions. And even though we might not fit inside certain boxes or certain deadlines or certain, program outcomes, the work that we inherently know how to do is truly healing and can really serve our people in a way that our systems aren't built to do. Thank you.
Thank you, Dr. Garcia. Let's go ahead and move on to Linnell.
Thank you. Well, good morning and or good afternoon to each of you. I am Linnell Smith and I am Diné, so I am a member of the Navajo tribe, born and raised. I am also the owner of Black Sheep Insight Consulting and Coaching. And as was mentioned by Ashley, I'm also a member of the advisory group with BHPN on the National Advisory Committee. I've had about 28 years of experience in the Native CDFI field. So my work really focuses on empowering individuals and organizations through various capacity building strategies, program development, and various types of financial education. And I guess what inspires me to do the work that I do in Indian country and to be a part of this network is really because I was born and raised on the Navajo Nation. So I'm very much in touch with what maybe our communities lack, but also how very resilient and powerful we are when we come together and through the power of like collaboration and networking. So I'm super excited to be here. It's such an honor. Thank you.
Wonderful. Well, thank you, everyone. I'm going to go ahead and move us along in the webinar. And so the first set of questions are going to be for Christine and Karen. If Christine and Karen, you can stay on. And as they mentioned, they're part of the collaboration between the Sault Ste. Marie tribe of Chippewa Indians and Mackinac Straits Health System. But before I get to the first set of questions, I'd like to give everyone a high-level overview of the project and partnership. And please note, we do have an in-depth case study of the collaboration with all the nitty-gritty details that we can share in the chat. But nestled in the heart of Michigan's Upper Peninsula, Mackinac County is a close-knit rural community with just under 11,000 residents. The area is home of the Sault Ste. Marie tribe of Chippewa Indians, a sovereign, federally recognized tribe with a service area spanning 7 counties across the Upper Peninsula. The only hospital in the region, Mackinac Straits Hospital, was on the brink of closure in 2008. It was in a dire situation for the entire community, but Mackinac Straits Health System stepped up and they forged a series of strategic community partnerships, including a powerful collaboration with the Sault Ste. Marie tribe. Fast forward to 2010, and this dynamic partnership resulted in the grand opening of a state-of-the-art healthcare facility and a tribal health clinic. So these two facilities, while independent, operate in harmony within the same building, offering complementary range of services to the community, which is a testament of the power of collaboration rooted in trust and mutual respect. So, Christine and Karen, one of the many reasons why we wanted to share your story is because your collaboration is deeply rooted in mutual respect and trust. So what are the important elements that helped you foster that trust and maintain it over time? And Karen, let's begin with you.
Ashley, you did a great job summarizing and providing the background and context. And I think it's really important to say when we started this journey, the hospital and the tribe were in a very similar situation where we had limited resources. We knew that in our current state, we were prevented from really growing and caring for the community in the manner in which we knew that we needed to do. We were incredibly fortunate to have strong support at many different levels to allow this relationship to evolve and grow over time. So Christine and I, had the support of each of our organizations, the various leaders who were involved at that time, local, state, and federal support, all of which was really critical to allow this to move forward. And I think, it may or may not need to be said, but I think it's really important to recognize, it would have been really easy for each of our groups, the hospital and the tribe, to say, gosh, it's a whole lot easier just to keep delivering care in the traditional ways that we always have. Right? There's less hoops to jump through. It's just a whole lot less complicated. I think in our case, we were incredibly privileged to have boards that stood behind the mission and the vision and enough, foresight and vision to really disrupt the care model to say, we've got to do something differently to move this forward. So I think it's just really important to recognize the individuals who supported us along the way and really made all of this important work possible. That led to, as we move forward, and those relationships were built, and as they were evolving, it got us to the point where we arrived at needing a location here in St. Ignace that was very accessible and visible, not only for the tribal population, but the general public that utilize the services. And even though we have a large land mass here in northern Michigan, getting at that very strategic location, again, that was visible and accessible for the community was really important. And the tribe and Christine's leadership and so many others provided us the avenue to do that, to identify that land, as you so nicely described it earlier in the discussion.
Yeah, thank you, Karen. And Christine, can you expand on how this common why between partners aligned with the needs of the Sault Ste. Marie tribe?
Sure. I just want to just make one correction. This our partnership and collaboration with Mackinac Straits, it's really only one of our areas of the unit. We have other hospitals and different types of relationships in the other 6 counties, but what's unique about with Mackinac Straits Hospital is that at that point in time, we were both needing services. I want to say with the Sault Ste. Marie tribe, we're just a young tribe. We're only been recognized for about 51 years. And we are not a reservation-based tribe. We signed a treaty in 1836 that gave up our lands. And so we really have had to purchase all of our land base aside from the 40 acres that we started in, and we're recognized as a tribe. So that's a real unique item that I think is unique to us. And so land is really valuable to us. But part of this whole thing was Mackinac Straits needed land to house this collaborative health center. And we felt the value of that was very important. And again, back to the community. So if you're ever up in St. Ignace, you'll see the beautiful site and be able to see where the hospital overlooks the water, and that's very important to our culture and who we are. So it was not a small gift. It was a very hard press that our previous boards really put in discussion and came along and gave that land so that the whole community could have, I apologize for that, could have a place to make it our home for the community. And I was born and raised in St. Ignace, so that's why I think my heart is really into this, as everyone else has. When you're born into a community, that is your community, and all of the community is part of that. So that really was part of that. As a self-governance tribe, if anybody understands tribes, you go through a process of being recognized by the federal government, and then you move through the process. And so we are a self-governance tribe. And what that means is that we make our decisions. We do get money from the federal government, but that's not all of the money that we need. We are short by millions of dollars for our healthcare. And so we have to do something unique and innovative. And that is part of our business model. So we gain businesses to support our services to our members. And so all of that makes it part of what government services are.
Great. And I think that leads us back to this central question that I mentioned earlier around partnerships rooted in trust that uphold self-determination, which you alluded to, Christine. So can you give us any concrete examples of how this collaboration was nurtured in that trust? And if at any point did it require any type of repair or reconciliation?
I think that this is an ongoing issue. You just don't have trust immediately. And we still are every day dealing with that. We have to strongly defend our sovereignty at the federal government, we're always coming under attack for a variety of different ways. Indian child welfare came on, a real strong push. Supreme Court upheld us as tribes that have rights under the Indian Child Welfare Act. There's numerous laws that we either get included or excluded that prevent us or help us make our own laws and govern our own individuals. We are a government, we're a strong government. We have to provide care for our membership. And so that's a huge challenge, and you have to be looking of anywhere that you can receive help along those ways. And healthcare is just, enormous issue for all of our members to provide care. We don't have a hospital, nor could we ever afford to have a hospital. The Indian Health Service has a waiting list that is just about, it could be 3 generations before you could even begin to think that you're going to get a hospital. So instead of trying to go for something that would be a real challenge for us, that's where we look for the partnership. And that's where Mackinac Straits came in. They could provide the hospital services that we desperately needed. And we could then cooperate and exchange other services that we can provide that Mackinac Straits doesn't provide, like dental care. Dental care is a huge issue in a rural community, and we provide dental care. Mackinac Straits has long-term care. If there's services that we can provide, then we're going to extend that and have a contract with them. They provide urgent care for us for after hours, so we don't have to do a whole after hours care. So there's many opportunities that we look where we cross help each other. When Karen needed additional space for her surgery, we looked at our space and what we could maybe do a joint agreement and lease back with her. So those are the things that we've done over the years to really kind of help each other. And that takes really daily work and honesty. And I think that's what we come into it, and we work at it. It's not just a given. So when Mackinac Straits Hospital joined an affiliation with another hospital, I had to do a lot of education with the new hospital board members of saying, wait a minute, you need to understand where we came from and how we're continuing to work so that our value of the tribe doesn't get just washed over or, not be attended to. And that took some time to really talk about that and be very upfront. And, those are the kind of conversations that you got to be able to have with each other and not let someone just kind of overpower you. And so I think that's the risk when you don't have in that continuous cooperation and conversations of the hard issues.
Yeah, and I know, Christine, one of the things that you mentioned to me that I thought was really important was you were saying, although you sit on the board of Mackinac Straits Health System, you don't represent your tribe. And so there is room for board to board dialogue. So leadership to leadership dialogue that you mentioned is really important, and that both leadership boards not only acknowledge that you have a common need, but you also respect each other's differences. Can you add on a little bit more to that?
Yeah, what I see my role on the hospital board, certainly I always represent my native indigenous, culture and who I am and what tribe I'm from, certainly bring that perspective, but I'm not given the authority to speak as my board of directors. They're elected leaders. They have that responsibility to provide that. So anytime that the Mackinac Straits board that I'm a part of has decisions and needs to work with my tribal board, I'm that liaison and create that space and get on the agenda and be there. But I don't speak for behalf of the board, and everybody is clear about that responsibility, because my role on the hospital board is a role really of a citizen of Mackinac Straits and in that community, and also a tribal member. But our tribal board, elected leadership, speaks directly to the Mackinac Straits Hospital Board, which I'm a part of. So it's a little unique difference. I think the other difference is my role with the tribe. As the executive director, I oversee all of the governmental functions. And Karen, as the president, oversees the whole hospital. So we're on equal paths. I've ran health centers, I've done healthcare. And I think that kind of unique background gives both of us that opportunity to cooperate and really talk about some of the direct clinic aspects that Karen oversees that is really directly in my tool bag that I've had to do for many years with a couple tribes that I've worked with. So, I think the boards appreciate each other. And so when we made any decision, it wasn't a decision between me and Karen. It was a decision between my tribal board and Mackinac Straits Hospital Board. And we came together and talked about this project and received the authority from that.
Right. And Karen, would you like to add anything?
I think Christine, you did such a nice job capturing it. The other piece that I would dovetail in on is, and as you've all heard described, beyond the bricks and mortar of the relationship, right? Anybody can build a building together, right? And establish space and leases and those sort of things. But well beyond that, when it comes to building the relationship and evolving, that's really where the hard work comes in. Christine spoke about the shared board seats, and I think it's a really important piece that was described very well. When you think about the work that gets done at board committee levels and all the things that transpire in the boardroom to support our organizations, that's really important. And I think the fact that we have that mutual respect of the process and the value, that we place on the governance structure, I think has really, carried us far. In relationships, they take work, right? They always need, it's nurturing, it's evolving. All of that stuff just doesn't happen, overnight. So I think the fact that we've got that mutual respect, to reach out to one another at any time as we're working through things is critically important. And I think, looking at what we accomplished just recently here over the past year, we came together and we were fortunate to obtain special funding here in the state of Michigan that allowed us to construct a medical office professional building. And as we were working on that and identifying the needs and looking at how we, captured the growth areas, I think it was a real demonstration of the relationship that we had to work together and really take it to the next level. So as Christine and I were talking in exploring options, we knew it was really important to get our boards together and have that conversation and look at how we took that project and really represented our needs and our populations in the best possible way. So looking, well beyond, 5-10 years and how we provide that space and the access and care for the community. So again, I just think I look back over the past year and what we accomplished. I think it's a real testament to the relationship.
Yeah, absolutely. And in addition to that maintenance piece, and I do know that both of you were not part of the initial partnership that brought together the hospital and the tribe. However, what do you think were the conditions that were really instrumental to forging this partnership that made it beneficial to both parties? And Christine, I'm going to go ahead and start with you.
Well, I think it's the same thing that Karen and I have developed over the years. That at that time, we had 2 board members that represent the St. Ignace area. And then we had a very strong CEO that was at Mackinac Straits. So they did the same thing. They had the conversations, they sat down for coffee, they, really talked about all of this. And because of those relationships, that board member who, was really kind of that liaison then with our tribal board to be able to have those frank discussions, and also with Mackinac Straits, and Mackinac Straits did the same thing. Their board met with our tribal board and really had those conversations from the very beginning. So it wasn't something that we had to try to figure out. They did it. they went out for coffee. They, you know, forged that relationship and tried to assist each other, you know, back in 2002, I'm thinking. And so it's really has been about strong partnership and, you know, sitting down. It's very basic, having coffee together, you know, doing other things that really led to this partnership. And then Karen and I were gifted and blessed with being able to carry it on to go forward with it.
And Christine, for folks who are joining us from other tribal areas, you mentioned that you went through the 638 process and are now a self-governing tribe. Do you think those aspects were important to be able to forge this partnership with Mackinac Strays?
I think it's extremely important. I started with my tribe very early on. I was like maybe the 9th or 10th employee. So I have been able to go through all the aspects of our growth into self-governance and really understanding all of the bureaucratic, you know, jumps that we had to do. And that really, you know, I understand exactly how it is even to get the 638 contract. A lot of the tribes are still direct service tribes, or, you know, they've stayed where they have not moved on to a self-governance tribe. Those are risky, and you just, you know, there are times where people try to scare you out of it or somehow convince you that you're not able to govern yourself and that we need the federal government to still control us and tell us what to do under the BIA or the IHS. And I think I worked for a very forward-looking tribe that always had self-governance as our goal and written right into the strategic plan. So we never got off course. And I think that's really what, you know, I grew up in as I started here, and really truly believe in that we know best what we need for our tribal people. And we have lived beyond, you know, with that. So we don't take no for an answer. When we run into a challenge, we're like, okay, then what legislation do we need to go change? How do we need to insert, you know, tribe in that funding source? Or how do we, you know, what is it that we do? And we actively engage in that. And that's really about education, legislation, Congress, you know, all the way to the president, if we have that opportunity. Our tribe participates in all of that. And we've done it from way early when we were there, because we never had money. We didn't get a big file full of money given to us. We've had to work for it.
And thanks to that work, the tribe had the land to donate as well as seed funding for this new hospital and tribal clinic. So Karen, what assets did the hospital bring to the partnership, and why were they so instrumental?
So regarding the funding, it was, I'll provide a summary here to try to give the best overview possible. But years ago, most hospitals, particularly in the rural areas, you know, operated under some type of a county structure. And for Mackinac Straits, for our hospital, we had the Act 47 designation, which really and truly meant that we were sort of, you know, county operated years ago. And we knew that in order to adapt with the changing landscape in healthcare, we needed to really revise that structure appropriately. And that was really important because in order to apply for all of the different lending opportunities that were there, we had to go to our county leaders and talk to them about the importance of the change, get their support that would eventually allow us to move forward to a 501c3 not-for-profit. And with their support, you know, and their buy-in and engagement and understanding change of the landscape, that then allowed us to apply for the various funding initiatives that were available. Absent that process, we would not have been able to move that forward. So in our case, once that step was accomplished, then it really opened up many different avenues for us. As mentioned earlier, the hospital was in a pretty significant position for risk of closure, as you mentioned, Ashley, early on. And so our funding and our path forward was critically important. We had limited time to accomplish what was needed to really bring the hospital forward and improve our overall financial health. In our case, I'll just touch on it just very briefly. We were able to work with the U.S. Department of Agriculture, the Small and Rural Development, to secure funding for the hospital. And so that allowed us to really take advantage of the interest rates that programs like that offer to support rural hospitals. So we're incredibly grateful for that, for all the help that we received at the state and federal level to move us in that direction. So that was one of the things, that we as a hospital had that really complemented the all of the various things that the tribal leadership brought forward. In order to build the hospital, we needed the land, as mentioned, earlier. So it really, when you look at how it all evolved and came together, I think we had the right combination of resources to really, move things ahead.
Yeah.
Go ahead, Ash.
Oh, actually, someone in the chat did have a question, which we are going to get to the others later, but I thought it was very relevant to this conversation as a clarifier. What is the designation of the hospital now? And is the tribal health program within the Indian Health Service?
I can touch on the hospital piece, and then I'll defer to Christine on the second part of the question. So currently today, we are an independent, not-for-profit 501c3. We have an affiliation here in Michigan that allows us to really take advantage and share resources with a larger system here in the state of Michigan, and that allows us to join forces for our electronic health record, which is really important. And as we continue to evolve in the relationship, we look at how we continue with the collaboration of care, access to care, access to specialists, and many other different things that'll be forthcoming as the relationship evolves.
And as far as the Sault Ste. Marie Tribe, Chippewa Indians, we are not run by Indian Health Service. We run our own health clinics throughout our area. That's why we're a self-governance tribe. And so we do receive revenue from the Indian Health Service under an AFA, and we negotiate what we can use those dollars from Indian Health Service, but it's really a tribal decision if they're not restricted funds. So we have expanded. We were one of the first tribes to offer traditional medicine as part of our healthcare system. We provide a lot of different services that Indian Health Service does not provide, that we've now funded through other means, either tribal support and or third-party revenues. So those are the decisions that are being made almost every year, depending on what our funding source is and what the needs of our tribal members have asked for, what they need. So for instance, if Indian Health Service only provides certain things under their pharmacy, under their formula, we have the opportunity to change that and provide things that the community is asking. We can change it immediately with the next board meeting. We don't have to go through the bureaucracy of Indian Health Service to say, yes, you can, or no, you can't. And one of those was like the shingles vaccine, for instance. That's just a simple thing, but our membership wanted the shingles vaccine available to them versus having to go pay for it themselves. And so we added that to our formulary. So those are the things that we can change within a matter of a couple months through our board decisions.
Great. Well, thank you so much, Christine and Karen. And now I would like to go ahead and pivot to an urban example and bring in Dr. Andrea Garcia for the conversation. Hi, Dr. Garcia.
Hi.
So Dr. Garcia is part of a groundbreaking initiative in Los Angeles, California, called the American Indian and Alaskan Natives Community-Led Housing Collaborative, or the Collaborative for short. It is a powerful alliance of American Indian and Alaskan Native community-based organizations and a local California tribal nation, all united by a common vision to create a truly transformative system of care for the area's Native communities. So the collaborative is focused on tackling the urgent crisis of homelessness among the Native population in LA County by building a sustainable, community-driven model for change. The collective aims to do this by receiving and granting funds that will support capacity building, fostering collaboration, and amplifying the voices of the American Indian and Alaskan Native communities, and by creating a powerful network of support, all dedicated to improving housing outcomes for the Native community in LA County. So, Dr. Garcia, can you provide us a little bit more context around the challenges of addressing homelessness for the Native community in LA County, an urban area?
Yeah, I would be happy to. And unfortunately, there's so many challenges being in Los Angeles specifically. So LA County is home to over 10 million residents spread over 4,000 square miles, which makes traveling and service provision very difficult. Oftentimes, our relatives will have to drive to get culturally responsive services, and they actually prefer to drive to our community-based organizations, to our tribes, in order to receive those services. So that's a huge challenge there in and of itself. Notably, we also, unlike many communities in the LA area, we do not have a single ethnic enclave, again, which makes it very difficult to just kind of drop in one service center in one location and assume that everyone's going to receive the services that they need. I think our homelessness governance system is also very intricate, and there's a push-pull sort of dynamic where the county and the city of Los Angeles have joint powers authority over our continuum of care. Not to mention the 88 other cities and many other unincorporated cities that also rely on that continuum of care. And so you can imagine that even though we have the largest population of Native Americans in the country, it's very difficult to get that political buy-in that we need and the attention that our community members deserve. Other challenges that I think are kind of ripe across all industries are data erasure, lack of representation on the various boards, difficulty identifying and obtaining resources and funding opportunities. And even though we're early right now, like we don't have Native housing built yet, there is a tribe that is in pre-development. I can't say enough about how difficult it is to navigate the coordinated entry system and how to prioritize our relatives once we have that housing in place. And so we've been thinking about this, raising this flag for at least 5, 6 years now. And it's very difficult to sort of maneuver around some of the fear-based, reasonably so, systems issues that unfortunately the other side of this word is not being able to prioritize and provide our relative safety in these spaces. So those are just a few of the challenges.
Yeah, and so why is the collective a innovative solution to this issue? And what role do multi-sector partners play in partnering with the collective to achieve a solution that does address affordable housing for Native communities living in urban areas?
Yeah, so I think just to be clear, our Native community has said that we want culturally safe spaces. So in other words, we want Native housing, we want spaces that are not going to re-traumatize folks. And so this collective is an innovative solution because we're working together to liberate resources that our organizations and tribes might typically not be eligible for in the mainstream system, at least not yet. And so these resources are specifically meant to help build organizational capacity and community capacity to advocate, to change the narrative, to do some of that systems change work, and do all of the things that we, again, already know how to do. Another thing that's really exciting is that we also get to learn and explore with each other and bring those learnings back to our COC. So just last week, we visited our relatives at the Chief Seattle Club. We've definitely invited them before to LA. We've invited our partners in Maricopa County to come talk from Native American Connections. But it's a totally different ballgame when you're able to see and envision these spaces, and also learn from them how they're doing the work over there. And again, hopefully bring that to our COC partners, who have the power over the systems. Another way that this is innovative is that, as urban people, we fully believe that tribal housing dollars should stay in tribes. And so this new way of operating, or again, liberating philanthropic funds or whatever other funds come our way, we're not trying to get in the way of tribal sovereignty, right? We're just trying to house using the systemic dollars that should be coming to our communities. And so I think by building a coalition, we're stronger together and better able to identify the needs of our community and put the resources where they need to go.
Great, fantastic. And then also, as you mentioned, Dr. Garcia, you are a public health leader working on Native American health for LA County. So what additional advice do you have for other public health organizations who want to form these types of partnerships with Native communities?
Yeah, so I'll pull in one other hat to help answer this. We at the local level, we have a Los Angeles City County Native American Commission. And we're really grateful for that. And so as part of that work, as a commission, we've been able to recommend to our county to work with our tribes. And what they've done most recently is produced a harms report where at least 6 of the 22 tribes with ancestral ties to LA County got together, named the harms, but also named recommendations for our county specifically to act on as systems. And so that's really instrumental, in addition to developing a county land acknowledgement. And so the land acknowledgement is important. Yes, we all agree. And it's how do you go beyond the land acknowledgement and how do you bring those recommendations from the harms report into our systems to be able to do that? So we have a guide, if you will, because our county decided that that was important work and that's something that we need to work on. And additionally, what I'd like to tell my other county partners from, different departments is like, what do you have leverage and positional power over? What are ways that you can bring that knowledge and expertise with this lens of knowing that these communities have different needs? And how can you change systems? And so, that's one sort of like structural way that we encourage our counties to make change. I guess I'll uplift really quickly that my own department was able to name American Indian and Alaska Native housing as a priority. And so developers were able to bid on funding opportunities to build Native housing. So again, just using our power where we can. And then from a human perspective, as Christine and Karen talked about, just developing relationships in a really genuine way. And when they say like going out for coffee, like absolutely, like go out for coffee, do the breakfast, lunch, and dinner thing, go into Native spaces and invite them to your space, which, may or may not be great all the time, depending on what kind of space you're in. But really make an effort to know the humans first, and go in with curiosity, as opposed to like, well, I really need to spend this budget and I really hope you all can take this money and this is what I need you to do with that money. So those are just a few things.
Well, wonderful. Thank you so much, Dr. Garcia. What I'm going to go ahead and do is actually move into the Q&A section. And I do want to acknowledge that we're getting close to the top of the hour. That said, our wonderful speakers have agreed to stay on for an extra 10 minutes. So if you are able to stay on, we are going to get to your questions. If you do have to leave, please note that we are going to put a survey into the chat. Please fill out that survey. That will help us continue to improve on our Network Commons webinars. So please make sure to fill that out. And with that, I'm going to invite all of our speakers to get back on camera. including Linnell, who will be moderating this Q&A.
Thank you, Ashley, and thank you to our wonderful speakers. We actually do have about 3 questions that popped up, so I'll just kind of open it up to each of you and who wants to respond. So this came from Ryan. Thank you, everyone, for sharing your experiences and wisdom. As a local government Native American program manager, how has data been shared or not shared between tribes and local government / private organizations, nonprofit organizations, etc. I understand that most states have sharing agreements, but I'm feeling that there is a sharing disparity between local government and with other tribes.
I'll take a stab at it. We are very protective of our data, and it goes long history of really distrust. And so in order for us to share anything to any of the government parties, we really need to know the why and what is the purpose. And so we have a process through resolution that the request comes in and we find out exactly what the data is for. And then if the board chooses to release it, then they will. We just really don't do a lot of data sharing.
Thank you, Christine. Andrea or Karen, would you like to add anything to that?
Just to add briefly, now that we are, just to take it a step further. So we have 2 different electronic medical records, as Christine described right now with the current, process. I think that we're excited about some opportunities moving forward where we may be able to potentially collaborate and share the same EMR moving forward. And again, that would still have all of the necessary, security provisions for data and so forth. But we're optimistic when it comes to collaborating care and access to specialists and so forth, as that decision is made to share that EMR, that may lead to some strengthening of the current relationship and the continuity of care.
Wonderful.
Just on that, we are still on the old RPMS system through Indian Health Service, and that's our electronic record. And so we are exploring going off on our own. We just don't have time to wait for Indian Health Service to change their electronic system. So we're looking at that this year to change that. That will give a lot more opportunities for shared data across for medical and our portals for our memberships also.
Wonderful. Thank you, Christine and Karen, for your response. We do have another question. This is from Alex. Can you expand on how the discussions, oops, my question went away. Hold on. Can you expand on how the discussions with county leaders lead to funding opportunities? Was it that their support needed to become 501c3 and funding was only available for nonprofits?
I can touch on that briefly, and I'll try to do it in the most comprehensive way. So as a county operated facility, and then having a what we have here locally, which we refer to as a county health services agreement, and at that time a shared building that was county owned. We didn't meet all of the criteria to qualify. And that would include really, initially when we started, we actually had a number of different private lending pieces that were in place in the early part of the relationship. As we moved forward and we looked at additional growth and we looked at the best way possible to achieve the funding that was needed, and also access the the most appealing, the most economically viable interest rates. That's where the U.S. Department of Rural Development came into play. So it was really establishing that clean line of division from the county to meet all of the various criteria. And I didn't spend a lot of time talking about it earlier, but also wanted to mention the support that we received from our foundation that was developed was also really a really critical part of this journey. So I just wanted to point out that, you know, having the backing and support of our health foundation was a really important piece to the work that we did. And I'm happy to share if anybody has any more specific questions on that or wants to take a deeper dive. I think my link and so forth is in the chat. If anyone would like to reach out for more information, I'm happy to share.
Wonderful. Thank you, Karen. And I think we have time for one more question. We are getting super close to when we said we would cut here. So this comes from Joy. I am curious to know if there's a tribal hospital or collaboration for the African community in the US. If so, where is it located? And if no, what suggestions do you have to start up one?
I'm not aware of one, not that I know of in Michigan at least. And I think that the issues are the same, that we would, you know, really encourage, you know, the discussions if it's a community development organization to really reach out. And I mean this in all sincerity. I think all hospitals or service providers, you know, I would beat the beat when I was a social worker to really reach out to any organization that provides services to our members and really ask them, what do they provide? What can we do? How can we partner? How can we share in that load? And that's really how you build that trust within the community. Tribes, you know, community organizations do not have the amount of resources needed to provide all the things that our members want and our community members have. So it's really like looking to see where are those gaps, what families are falling, you know, through the cracks. I loved Ashley's, you know, summation, because we just took on the homelessness. We did not have a real good homeless program. So what this tribe did was bought a motel and we turned it into a homeless shelter. That homeless shelter, since we opened it up, has been completely full and has a waiting list. That was a service that we just didn't have for our members. And we were providing patchwork care of putting them up in hotels. Well, you only have so many hotels that will take homeless people. And then it's also not culturally appropriate. It's not, you know, always good for families to be there with single, maybe males that are have some addiction problems. So we're just constantly looking at where are those gaps and then reevaluating and trying to take those on.
Wonderful. Thank you, Christine. And I believe we are at time. And I want to go ahead and hand it over to Ashley and thank all of our panelists here. Thank you.
Yes, I do just want to say thank you all for joining us today. And if you are interested in learning more about multi-sector collaborations to advance health and racial equity and would like to attend future events, please be sure to sign up for our newsletter. We call it The Pulse. You can find the link in the chat as well as in the middle of our website. Additionally, we'd also like to share additional resources like our crosswalk essay, which you're going to find in the chat, which explores more multi-sector collaborations with Native and tribal communities that are working to improve the social determinants of health. And so before we wrap up, a huge thank you to our incredible panelists for sharing their wisdom and experiences today, as well as their insights. They have been invaluable. And we do want to hear from all of you now. So we do have that quick survey that we've included in the chat. And this is an opportunity for you to share your thoughts with us. Let us know what worked well, what you would like us to touch on in the future. As I mentioned, your feedback is essential. So please take a moment to fill out that survey. So thank you again, everyone, for joining us. And we hope to see you at our next Network Commons. Thank you, everybody. We appreciate it. Bye-bye.